In 2021, the government procured a system to track vaccines. This system, Vaccine Connect, is set to cost Canadians over $59 million. The government then decided to delay the development of key capabilities, forcing employees to use spreadsheets instead. This led to significant waste of vaccines and taxpayers' dollars, including confusion on expiration dates. Why did the government delay key developments on its own project, wasting vaccines and taxpayers' money?
The Honourable Parliamentary Secretary to the Minister of Health.
Thank you very much, Mr. Speaker. Canada's COVID-19 procurement strategy was undertaken at a time of considerable uncertainty with the goal of protecting the health and safety of Canadians, and that is what we did, Mr. Speaker. While Canada's overall COVID-19 immunization strategy has been a success, with modelling suggesting that public health measures without vaccination could have seen over 16.5 million cases and nearly 500,000 deaths, improvements can and will be made to ensure continued success and future preparedness. But, Mr. Speaker, there was no waste. That is a false claim. And to suggest that we didn't act expediently, Mr. Speaker, is outside of the frame of...
For Carlton Trail, Eagle Creek.
Well, Mr. Speaker, perhaps that member would like to have a conversation with the Auditor General. In her report this morning, she made it clear the government is on track for almost $2 billion in wasted vaccines by the end of this year. Over 15 million doses wasted so far, with the potential of the majority of another 55 million set to expire in 26 days. This government took vaccines meant for underdeveloped countries, the only G7 country to do so, while wasting billions in expired vaccines. When will this government stop its wasteful spending of taxpayers' dollars?
Good job. The Honourable Parliamentary Secretary.
Vaccines during a deadly pandemic was wasteful. Context matters, Mr. Speaker. At the start of this pandemic, no one could predict which vaccine would be most effective, and with an increased global demand, our government prioritized protecting the health and safety of Canadians. Exactly. We will continue to work to keep securing the vaccines that Canadians need while taking measures to manage our supply and reduce wastage, Mr. Speaker. As recommended, we will also continue to work with provinces, territories, and Indigenous partners to enhance data sharing across jurisdictions and partners through a pan-Canadian health data strategy. Thank you, Mr. Speaker.